Hi, my name is Taylor Purvis. I'm a University of Manitoba student nurse, and today I'm going to be demoing a subcutaneous injection. So the first thing I'm going to do is I'm just going to look at my scenario here. So we have med demonstration part 1. The date is February 7, 2021, and the time is 08:25, and we're going to be administering medications this morning. So after that, I'm just going to compare my MAR with my physician's order. So we have Jake Nursing, date of birth, January 1st, 1960, date of birth, January 1st, 1960, so that's correct, that checks out. We have no known allergies, so that's good. I'm just gonna note that all of these medications have been properly transcribed and double signed, so that is good. And we're gonna be administering medication today for uncontrolled nausea secondary to chemotherapy. So I'm just gonna start with my first drug here. So we have metoclopramide, right drug, 5 milligrams, right dose, subcutaneous, right route, daily, right frequency, and it's written once at 0800. It is the 7th at 08:25. We are within that time frame, and this hasn't been given yet today, so we are going to give that drug now. So next we have diamond hydrogenate, right drug, 150 milligrams, right dose, intramuscular, right route, daily, right frequency, and it's written here once at 2100. It hasn't been given yet on the 7th, but we are not within that time frame, so we won't be giving that drug right now. And once I've done that, I'm just going to put my physician's order away. I'm just going to grab my proper medication here and compare it to my MAR. So I have metoclopramide, right drug, 5 milligrams. This is 5 milligrams per ml, so I'll be giving 1 ml of this medication. So it says subcutaneous. On here it says IM and IV, but I have called the doctor and the physician, and the pharmacy, and they have given me the go-ahead to use this drug as for subcutaneous, so I'm going to go ahead and give this subcutaneously. And then it says daily, so it's written here once. The time is 0800, it is 08:25 on the 7th, and it hasn't been given, so we can go ahead and give this medication. I'm also just going to check to make sure that the drug is not expired, and it is not, so that is good. So next I'm just going to check the parenteral drug monograph. So we have metoclopramide, it's an antiemetic, other names are Maxorin, it can be administered by a student nurse. The usual dosage is 10 to 20 milligrams every 4 to 6 hours, and we're giving 5 milligrams, so that is a safe dose. Maximum daily dose is 120 milligrams, and we're not going to be exceeding that today. So here it does say it can be given subcutaneously, administered undiluted, so that's what we're going to do, with a maximum concentration of 5 milligrams per milliliter, which is what this is, so that is good. I also just looked over any other information on the drug monograph, including potential hazards and any other information that might be important. So after I did that, I'm just going to talk a little bit about the drug indication. So for this drug, we are going to be using this drug today for its antiemetic effects as our patient suffers from nausea and vomiting due to their chemotherapy. This drug works by blocking dopamine and serotonin receptors in the chemoreceptor trigger zone in the CNS. So safe dose for this drug, like I said, we're giving 5 milligrams. The usual dose is 10 to 20 milligrams every 4 to 6 hours, max dose of 120 milligrams. So some common adverse effects include restlessness, drowsiness, dry mouth, anxiety, and constipation. Some common contraindications for this drug include GI hemorrhage, obstruction, and perforation. The use of anti-epileptic drugs, Parkinson's disease, liver disease, depression, renal impairment, and diabetes. Some drug interactions include additive CNS depression when used with other CNS depressants such as antidepressants, sedative hypnotics, antihistamines, opioids, and alcohol. Some nursing indications include assessing for a history of hypersensitivity to the drug, renal impairment, vital signs, ins and outs, daily weights, serum electrolytes, and blood glucose. So after I've just gone over all of that, I'm just going to wash my hands and I'm going to gather my correct supplies. So I'm going to be using a 3 ml syringe to draw up 1 ml of the solution, so that's good. I'm going to need a blunt fill needle to draw up from my vial, and I'm going to get my correct injection needle here. So for a subcutaneous injection, we're going to need 25 to 31 gauge. This is 27 gauge, so that's correct. And we're going to need length of 1/2 inch to 5/8 of an inch. This is 1/2 inch, so that is correct. So once I've done that, I would just check the integrity of these packaging. Obviously for demo purpose, these already been opened, but in clinical setting, they would be new packages for these items. So after I've done that, I'm just going to wash my hands. I'm going to open a new alcohol swab. This can go in the garbage. And I'm going to clean the top of my vial here for 30 seconds in a circular motion. So for demo purposes, I'm going to say that was 30 seconds. And I'm going to let that dry, throw that in the garbage. So after I've done that, I'm just going to open my syringe here, making sure I'm not breaking sterility of the sterile aspects. I'm going to open my blunt fill needle. And we're going to attach it here. So once I've done that, I'm just going to draw back the right amount of air to set up my pressure system. So we're going to draw back a little more than 1 ml. I'm going to take the cap off of this and I'm going to inject into you. Sorry, new one here. So I'm going to inject the air. Flip this upside down. Just gonna let the gravity do the work here. So once I've gotten a little more than 1 ml, just to account for any bubbles, I'm going to take this out and I'm going to recap my needle using the scoop method. Okay, so that's good. And at this point, I'm just going to knock out any bubbles. So once I've gotten out all my bubbles, I'm just going to pull back to make sure I've got all the medication in the blunt fill needle. At this point, I'm just going to remove my blunt fill needle. I'm going to discard of that in the sharps, and I'm going to open my injection needle here. I'm going to attach this here. Once I've done that, that can go in the garbage. So I'm going to be doing this over med waste, but at this point, I'm going to be calibrating to the right dose here. So once I've gotten the right dose and making sure that there's no bubbles, I'm just going to put this down so that you can see the right amount here. Good. Okay, so after I've done that, I'm just going to make a med label for my medication here. So we have Jake Nursing. The drug is metoclopramide. The dose is 5 milligrams. Volume is 1 ml. The concentration is 5 milligrams per ml. The date, so it's February 7th, 2021, and it is 0825. And TPUMSN2. So after I've done that, I'm just going to write that this drug is also to be given subcutaneous. So after I've done that, I'm just going to attach this to my the cap of my needle here. I don't have the right sticky labels, but I would do that in real setting. So after I've done that, I'm just going to go ahead and I'm going to be doing my second check here. So we're going to be taking my syringe here, my label and my MAR and my medication and just doing a second check here. So we have Jake Nursing, right patient, so January 1st, 1960, he has no known allergies. So we have metoclopramide, this is metoclopramide, so that's the right drug, 5 milligrams per ml, this is 1 ml with no bubbles, so that is correct. We have subcutaneous, I've written here subcutaneous, this is the right subcutaneous needle that I've chosen, and this drug, like I said, I've called the physician and the pharmacy, and they've said that I can give this drug subcutaneously, so that is good. It says daily, it's 0825, here it says I can give it at 0800, it's on the 7th, it hasn't been given, and we're within that time frame, so I can go ahead and give this drug now. So I'm just going to get my stuff ready to go into the into the patient's room. This was a single-use vial, so I would have discarded this in the proper med waste bin. So after I've done that, I'm just going to get the rest of my supplies. So I have my gloves, my clean gloves, an alcohol swab, a cotton ball, and my MAR, and I already have a pen in the room. I'm going to be signing with a pencil today, but I would normally sign with a pen, but for demo purposes, we're going to be doing that. So I'm going to enter the patient's room, and I'm going to perform hand hygiene. From here, I'm going to introduce myself to the patient. So first I'll do my entrance safety check, so making sure the bed's in the lowest position, the call bell's within reach, the side rails are up as appropriate, and the patient is in no distress. Then I'll introduce myself. Hi, I'm Taylor Purvis, a University of Manitoba student nurse, and I'm going to be administering your medications today. So after I say that to the patient, I'm just going to ask them their name. So he would tell me Jake Nursing. I would ask him his date of birth. He would say January 1st, 1960. So that would check out. So that's right. And I would double check with the wristband. So we have Jake Nursing, right patient. Date of birth, January 1st, 1960. January 1st, 1960. So that's correct. I would just ask him if he has any allergies. He tells me he has no allergies, and we have no allergies here, so that checks out. So after I've done that, I'm just going to let him know that I'm just going to be doing my third check, and then I will talk to him. So after I've done that, I'm just going to set up my station a little bit here. So we have my alcohol swab, there we go. So I'm going to be doing my third check here. So I'm going to be comparing my syringe with my label with my MAR. So we have Jake Nursing, right patient. So it's January 1st, 1960, date of birth. He has no known allergies. So that's good. So we have metoclopramide. This is metoclopramide in my syringe. We have 5 milligrams. So it's 5 milligrams per ml. This is 1 ml with no bubbles. So that is correct. We have subcutaneous, this is the correct subcutaneous needle, so that is good. We have daily, it's written here at 0800 once, so it's 0825. It is 0825 on the 7th, it's to be given at 0800. We are within that time frame, so I can go ahead and give this drug now. So at that point, I'm just gonna put this here, and I'm just gonna talk to my patient about the procedure, so I'm just gonna explain the procedure to him. So we are going to be giving you a subcutaneous injection, and we've already talked to him and he is okay with getting the subcutaneous injection into his stomach. So we're going to be giving you a needle into your subcutaneous fat in your stomach, which is going to give you medication that'll help with your nausea and vomiting today. So after I've explained the procedure and we do have cooperation with the patient that this procedure is okay, I am just going to go ahead and tell him what we're going to be assessing prior to giving the medication. So I'm going to be assessing for his nausea and vomiting. I'm going to be assessing his vital signs, his ins and outs, his daily weights, his serum electrolytes, his blood glucose, as well as for any hypersensitivity. I'll give him a couple side effects. So for this drug, the side effects include restlessness, drowsiness, anxiety, and constipation. So after I've explained that, I'll just give him a little bit of patient teaching. So for this drug, I would recommend that you avoid operating any heavy machinery because drowsiness is a side effect. I would recommend that you avoid alcohol, and I recommend that you take this medication 30 minutes before meals on an empty stomach. So after I've explained all that, I'm just going to properly landmark. So for this patient, I'm going to be landmarking 5 centimeters from his umbilicus, making sure to avoid any areas around the stomach that have bruising where a prior injection might have been given. So after I have done the proper landmarking and the patient is okay with that, I'm just going to raise the bed to the proper height for me to give the injection, and I'm going to expose the patient's stomach so that I'm going to landmark where I said, so we've chosen the right spot, a clean area of skin. So after I've done that, I'm going to go and I'm going to wash my hands and I'm going to apply my clean gloves. Okay, so after I've applied my clean gloves, I'm just going to get my alcohol swab. I'm going to open it, take it out, and I'm going to clean where I've landmarked in a circular motion on the patient's skin for 30 seconds. So for demo purpose, I'm going to take that 30 seconds. I'm going to let the spot dry. I'm going to throw that in the garbage. So for this patient, he is a little bit overweight. So I'm going to be able to pinch the full 2 inches and inject at a 90-degree angle. So I'm going to get my syringe here. And I'm going to just move the safety to the side just for proper administration of the drug. So I'm going to do that. I'm going to take off the cap of the drug and discard that in the garbage. So I'm going to pinch 2 inches like I've said. So I'll pinch the 2 inches. I will insert at 90 degrees. I will stabilize, and then I will inject at a slow and safe pace. So I'll wait a couple seconds. Once I'm done injecting, I'll remove my stabilization. I'll remove the needle. I will remove my pinch. I will activate the safety mechanism of the needle, and I will discard this in the sharps. So after I've done that, I'm just going to hold my cotton ball onto the patient where I've injected for about 30 seconds to get any blood or anything. So after I've done that, we're going to say that was about 30 seconds. I'm going to remove my clean gloves and throw those in the garbage, and I'm going to perform hand hygiene. So after I've done that, I'm just going to document my procedure here. So we have 0825 TPUMSN2. So after I've documented the procedure, I'm just going to talk to the patient a little bit about what we're going to be monitoring after giving this medication. So we're going to be monitoring for therapeutic effects of the medication, so a resolution of the nausea and vomiting secondary to his chemotherapy. We're going to be monitoring his vital signs, his ins and outs, his daily weights, his serum electrolytes, his blood glucose, as well as for any signs of the side effects that I've mentioned earlier and any signs of an allergic reaction. So after I've explained all of that to the patient, I'm going to do my exit safety check. So I'm going to make sure the bed is in the lowest position, the call bell's within reach, the side rails are up as appropriate, and the patient is in no distress. So after I've done that, I'm just going to gather my supplies and I'm going to leave the room. At this point, I would document anything that would be appropriate for this, so possibly vital signs, ins and outs, daily weights, anything that might be important for this specific medication and for this specific facility, and then at that point, I would be done.